Hello, everyone. This is Dr. Ashkan Lashkari, MOASC president. Today, we'll be conducting our monthly uh, uh, spotlight on our clinical researcher of the month. And today, we're proud to present Dr. Syma Iqbal, medical oncologist and associate professor of clinical medicine at USC. And I know that she's been there for a little while now. Thank you so much, Dr. Iqbal, for joining us and talking to us.
Of course, thanks for having me.
So, the goal here is to learn a little bit about you and your clinical interests. And so we'll start there. Perhaps give us a little bit of a background as to what you're currently really focusing on in your area of oncology, which I know is GI based.
Right. So I'm a GI oncologist, and currently my research interests are in esophageal gastric cancers. So I do clinical research largely, and so most of what I have are clinical trials for esophageal gastric cancers.
Can you elaborate on a couple of the trials that you're most excited about and what we can learn from them?
Sure, yeah. So this has been a huge time of change in esophageal gastric cancer. Over the last few years, we've seen a change in therapy in that we only had chemotherapy to offer patients, and now with the with the positive clinical trials incorporating immunotherapy, immunotherapy really has dominated the frontline setting of studies in esophageal gastric cancers. And so the trials that we're now looking at is to see if we can actually add to that, if we can further immune modulation, if you will, to further the efficacy of combinations, immunotherapy with chemotherapy. So, for example, I have a few trials in the frontline setting for metastatic gastric or GE junction cancer, combining PD-1 inhibitors with anti-TIGIT, which is another immune modulator thought to be synergistic with the PD-1 inhibitor and enhance, that immune activity that we're looking for. That is in combination with standard frontline chemotherapy. Another interesting agent I have in clinical trials for the frontline setting, again in metastatic gastric or GEJ, is looking at a new agent called DKN-01. DKK is involved in Wnt signaling and also is thought to have immune modulatory properties. So DKN-01 is an antibody that targets DKK, and in combination with chemotherapy has shown really interesting preliminary activity, in small numbers, but response rates, approaching 80%. So we have further accruing to a trial, which is now randomized, looking at the addition of DKN-01 with immunotherapy plus chemotherapy versus, standard of care chemo plus immunotherapy. So that's another agent that we're quite excited about and are currently accruing to.
A question for you. Are you also looking at antibody drug conjugates in this area as well?
So I don't have, great question. As you know, with trastuzumab deruxtecan, we have a new agent in the HER2 positive arena. The area of interest now for antibody drug conjugates is actually in this HER2 low population. So we should be getting, hopefully we'll be getting some trials looking at these HER2 low patients with specific antibody drug conjugates, but I don't have one yet. I do have another trial which will be opening very soon, which is targeting Claudin 18.2,
Right.
is our CAR T study. It's a new, it's a different agent than what we've seen presented already. Preliminary data looks really promising, but it would be for your very good performance status patients. We could screen them while they're getting first-line therapy, and the option, if they're positive for Claudin 18.2, then and maintain a good performance status, they could be treated in the second or third line setting. So another kind of hot area of research with CAR T in these solid tumors, and particularly esophageal gastric.
Yeah, it's amazing to see all of the different types of therapy that are becoming so predominant in the GI space, and this is really such a wonderful time to be able to help our patients with potentially more active therapies than traditional chemotherapy, which after first line we don't tend to see as much of a robust response. So certainly exciting to see all of these new agents.
Definitely, yeah. I mean, I think immunotherapy is where we're looking for the biggest change and trying to modulate the agents that we have. That we have other pathways that we're continuing to investigate as well in the refractory setting. As you said, our patients now, more and more our patients are looking for second and third line. They do maintain a good performance status, so we have trials in those areas as well.
This is fantastic. Well, thank you so much. I think that kind of is a great summary and into what you've been doing, and it sounds like you're quite busy in this area, and certainly this is an area where I think any patient with esophageal gastric cancer should enroll in trials at some point in their journey, only because we need new agents in this area. So thank you so much for joining us and being a part of this discussion. And we'll sign off and go from there. Thank you so much.
Thanks a lot.